that's okay with you, Annie.
Sure, that's okay with me. Welcome everyone. This is the third year. Katie, please correct me. This is the third year I think we're hosting an info session, and essentially this info session is just a way for us to get to meet people who are interested in the Dental Public Health Residency Program at UCSF and to answer all your questions, and just to get you familiar with what dental public health is all about and to meet some of our alumni and our current residents. And so with that, I'll just go ahead and move into the presentation. So this is the brief agenda that we have today. We'll do introductions, and then I'll talk a little bit about the program. And then you get to meet our current residents. They'll discuss their field sites, and then you'll meet one of our alumni, and she'll discuss her career and the impact of everything she's doing. And then we'll open it up to questions. So if you have any specific question that hasn't been covered yet, then we can discuss that at the end. All right, so as you probably know, my name is Annie Obadan-Udoh. I am the program director for Dental Public Health at the University of California, San Francisco. We also have our division chair, Dr. Lisa Behrens. However, I think she's just listening in today, so she might not be able to unmute herself due to some family challenges, but we'll keep going, and we know that she's with us in spirit. All right, and then if you don't mind unmuting yourselves, I'll start with Hayam. If you can just give us a brief introduction of who you are and where you work, then we'll move on to the residents.
My pleasure. Thank you for the invitation, Dr. Annie. I'm Hayam Megali. I was a resident with UCSF DPH program 2021, 2022, and I'm glad to be here with you today. I now work with Alameda County Department of Public Health, the Office of Dental Health, a program specialist with them. Thank you for the invitation.
Thank you. All right, and with that, I'll call on Eva.
Hello, everyone. I'm Dr. Evangeline Ida. I'm a foreign trained dentist, and I'm a current dental public health resident at UCSF.
Eva is also the president, right, of the AAP student chapter.
I am. Yeah, I'm the president for a PhD student organization, which is Dental Public Health student chapter at UCSF. So I'm serving as the president for this year.
All right, thank you. With that, we'll pass it on to Lauren.
Hi, my name is Lauren Gritzer. I received my DDS and MPH from the University of Maryland, and my field site is up in Sonoma County.
Okay, thank you. And then Harpreet.
Hello, I'm Harpreet Kothra. I'm a foreign trained dentist, and my field sites are La Clinica, Fruitvale, and Santa Clara County Dental Society.
All right, and then you'll get some time to discuss your field sites, but let's see. I don't think we have time to, maybe when we start the Q&A, if you could introduce yourself before asking a question or speaking, that would be great. All right, so moving on, just to give you a general overview about dental public health, in case you were wondering what this specialty is all about. So DPH is the science and art of preventing and controlling dental diseases and promoting dental health through organized community efforts. We deal with the community as our patient rather than the individual. We are also concerned with dental education of the public, applied dental research, the administration of group dental care programs, as well as the prevention and control of dental diseases on a community basis. And this is the definition that has been adopted by the American Board of Dental Public Health. To become a DPH specialist, there are then key competencies that the American Board of Dental Public Health has outlined. The first one is to be able to manage oral health programs for population health. The second is to evaluate systems of care that impact oral health. The third is to communicate on oral health and public health issues. Also to advocate for public health policy, legislation, and regulations. To conduct research to address oral and public health problems. To demonstrate ethical decision-making in the practice of dental public health. To design surveillance systems to measure oral health status and its determinants. To lead collaborations on oral and public health issues. To critically appraise evidence to address oral health issues for individuals and populations, and then to integrate the social determinants of health into dental public health practice. And so every residency program is trying to provide opportunities for residents to develop competency in these 10 areas. And when you think about it, if you're a clinician and you want to compare the duties of a dental clinician to that of a DPH specialist, this slide just really helps to outline what the similarities are and what the differences are. So for example, as a dental clinician, you were taught to focus on the individual patient. However, like I said earlier, as a DPH specialist, you're really focusing on the community as your patient. Similar to the way the dental clinician conducts exams, as a DPH specialist, we have surveillance systems where we collect data on the community's oral health status. We conduct needs assessments to try to understand what is going on in the community regarding oral health. And the third one, we try to establish a diagnosis. Again, we take this data that we collect, we analyze it, we try to interpret it and make predictions or try to describe the population's oral health. And then when we understand the findings, we try to develop a treatment plan. And in the community, this usually looks like a community health improvement plan. It looks like an oral health strategy. We take all of the data from a needs assessment. We take all of the data collected through surveillance, and we try to come up with an intervention to address the needs of the community. And then we provide treatment by implementing these plans. And then, of course, rather than getting payment for our services, we can either bill the insurance company, or most likely in public health, we tend to get grants or get budget allocations or receive revenue from government officials. And then lastly, we schedule periodic follow-up visits as a clinician. And in the public health space, this just means that we monitor and evaluate the impact of whatever program we've implemented in the community. So where do DPH specialists work? As you can see, they're very big buckets, areas where DPH specialists generally work. They could either work for a government agency, or they could they could work in a public health setting, providing clinical care, such as a federally qualified health center or a tribal health center. And then we also work in research, education, schools of dentistry, schools of dental hygiene, school-based programs. Some DPH specialists go into consulting. They work for nonprofit organizations, community-based organizations, and then some are involved with advocacy through national bodies such as the ADA or ADIA. So when it comes to the UCSF Dental Public Health Program, we have two main options for now, and we have a third option that is in progress. The first option is the joint program with UC Berkeley. And Harpreet and Eva are graduates of this program. This pathway is typically for dentists who do not have an MPH. degree from the United States. And so for that program, you need to apply to the UC Berkeley Interdisciplinary MPH, and then that serves as your first year of a 2-year pathway. And then the second year, you cross over to UCSF, where you complete the 1-year DPH certificate program. The traditional option is the 1-year full-time certificate program, where if you already have an MPH from a US educational institution, then you can just apply directly to UCSF and complete a 12 months program. However, if you're not able to engage in the full-time program, we are in the process of receiving approvals to offer a 2-year part-time remote program. And we hope that that would be ready in time for the next admission cycle, not this year. All right, and so as one of the requirements to apply directly to the UCSF DPH program is that you must have the MPH degree, and your MPH degree or equivalent master's must have these 5 prerequisite courses. You must have a transcript that demonstrates your coursework in epidemiology, biostatistics, behavioral health, and environmental health, healthcare policy and management, and ethics and professionalism. We do offer an ethics course, so that can be waived. And if there's 1 or 2 courses missing, typically we can work with you during your DPH program to complete the outstanding course. However, if there's more than 1 course missing, then typically the master's degree is not considered equivalent to a master's in public health. All right, during the program, there are core courses in dental public health and there are elective courses. We generally encourage everyone to take all these courses because they play different roles. So for the core courses, we have the guest lecture series where we invite experts from around the country to come present on their ongoing work and provide insights regarding the work that they're doing. We have the core dental public health projects course, which is really the course that guides you on your research projects. And then DPH 410 is where we discuss the core and contemporary topics in dental public health. There's also the field site experience and practice where our residents go into the community and try to work on a community-based improvement project. They try to work on getting exposure to dental public health in action. We also have the quality improvement course, which allows our residents to work on improving the quality of care, typically in the public health setting. So either a school-based program or a federally qualified health center or just a community health center. And then our intro to dental public health, which is just some fundamental basics about dental public health. The elective courses, like I said, we do offer an ethics course. There's also a research methods course, a biostats course, and a pediatric dentistry course for dental public health students. And so any of these courses can be taken. We encourage our residents to take all of them, just so that you can brush up on your skills from your MPH program, or you can refresh your memory. All right, and so our field sites, we do work with a number of public health departments. We are capable of working with any public health department, but for now we do have agreements with these 4 sites, and that's where our current residents are working. But we have agreements with other counties depending on the interest of the resident. These are examples of some projects from last year, some community-based projects. The first one was an evaluation of the referral system from a school-based center. And this just shows, the number of days to appointment. And this year, I think we're supposed to be working on reducing the number of days. So it's just broken down by the urgency of treatment. The second one is a project on early child care centers. and trying to implement a toothbrushing program at the early childhood child care centers. And then the last one was about ED visits for non-traumatic dental conditions. And we see this is also broken down by urgency. And so we try to see how many, over time, how many urgent cases actually get seen at the emergency department. So these are examples of the types of community-based projects that our residents work on. If you have any questions about the admission process, typically that question has already been answered on our webpage. So I encourage you to go to the webpage and just browse through all the different sections, there are various sections, including the FAQ section, because that typically has some specific answers to questions that have come up in the past. But if you're not able to find an answer to the question that you have, feel free to email us, contact us. We do have a social media handle, so we post things that our residents are doing. We post anything we find interesting, and so please follow us on social media at UCSF DPH Postgrad, both on X and Instagram. And then as part of the Dental Public Health Program, we received grant funding from HRSA, which is the Health Resources and Services Administration. And so we have this website that just describes the grant program. It has helped us to improve the quality of our residency program. It has helped us develop new courses. It's also a collaboration between dental public health and pediatric dentistry. And so that's why you have the course in pediatric dentistry. There are a couple of areas where we work. The first objective of this grant was to increase the cross-learning between DPH and pediatric dentistry. And so that's why we have the courses. We have DPH residents and PD residents taking similar courses. We're able to offer an MPH training program to the pediatric residents, and we're able to offer a stipend to the DPH residents to offset the cost of tuition and the cost of attendance. We're also able to provide the opportunities for our residents to pursue QI projects at the FQHCs. We can provide for travel to field sites, travel to FQHCs, and support in general to the FQHCs that our students are working at. We also provide opportunities for travel to rural communities through the field site rotation and to work in the virtual dental home, which is currently in Tuolumne County. And then there's an opportunity to pursue dual specialization. So both pediatric dentists pursuing dental public health and dental public health residents pursuing pediatric dentistry. Of course, you need to meet the minimum application requirements for each specialty. And then in the first year, we were able to offer a telehealth program for autism. That clinic is still running, and so there's an opportunity to participate in that clinic if that is something that interests you. All right, so financial information. So right now our tuition and fees, so this is not just tuition, this is including all the fees for both summer and health insurance. It's about $27,000 for an in-state resident and about $42,000 for an out-of-state resident. Like I said, we do have funding through HRSA to provide up to $38,000 for out-of-state residents, or $25,000 for in-state residents, and then a stipend of $10,000 to $15,000. We also have funding through the California Office of Oral Health, a total of $60,000 per year. And so depending on the number of students that require this, we're able to split this amount amongst the students. So anywhere between $15,000 to $30,000 is what each resident would get. And then, like I said, we also pay for travel to all field sites and rural areas. And this can be applied to non-residents, which is a good thing. And then there's non-US residents. And then the last option is financial aid. We do have some non-cosigner loans available. So like I mentioned, if you want to apply, a lot of this information is on our website. We do use ADIA Pass. And the deadline for application is February 1st. So if you're planning to apply this cycle, please begin to put together your application. This is a very firm date. And so please try to submit your application before that date. And then there's a non-refundable application processing fee that is due to the school February 10. Feel free to email me once you submit your application. But even if you don't email me, the admissions office would correspond with you once your application is in and complete. We typically organize our interviews remotely. And so once we are done with the application reviews, invitations will be sent out sometime in the late February / early March period. All right, and these are a list of things that you need for your application. And with that, I'll move on to our current residents. I believe we're starting with Lauren. So.
Do you want to go first?
No.
No? Okay. All right. So as I said earlier, hello, my name is Lauren Gritzer. I am stationed up in Sonoma County. So the federally qualified health center that I'm working with is the Russian River Health and Wellness Center, which is in Guerneville. They also have a location in Sebastopol. And I'm actually doing my major project. My project with them turned into my major project, and I'm also doing my quality improvement project with them. And so moving on to the next slide, it kind of goes more into my major project. Yes. So, from talking to the dental director up there, he's constantly hearing from his patients and other people in the community that the drinking water is gross. And so we decided that our project, he's also an ECSF champion, provides in the CSF program, kind of like a public provider for people who do not have MPHs. And so we are doing this together, and it focuses on tap water quality perceptions and how that translates to tap water, bottled water, and sugar sweetened beverage consumption. And what we kind of started out doing was doing informal interviews with lifelong residents. And we're hearing that the water doesn't smell good, it doesn't taste good, it looks murky. And actually, when I was looking at the Sweetwater Springs report, it basically kind of has the clearness of the distilled water, which is the bottle on the right. So it's not this crystal clear, like lovely looking water. And so we are doing a survey up there. I just finished writing the survey, and we're going to be surveying his patients and just kind of looking at how much this lack of tap water drinking is affecting their sugar sweetened beverage consumption. It has been shown people who do not drink tap water drink significantly more sugar sweetened beverages. So we're looking into that and then trying to probably create some sort of clinical guidelines for areas that have similar situation, and just to get clinicians to promote drinking water more. Because I think what we're also thinking is that, if somebody's having to purchase something to drink, they're probably much more likely to drink something that tastes good to them rather than water, regardless of the cost. And so that's kind of my major project. My other minor project I'm working on is doing something with Big Mouth, which I don't know if you guys have heard about. It's a dental repository, like about 11 schools in the country give their data to this repository. And that's what that is. And then my other field site is at the Sonoma County Department of Health Services, and I'm working with the Sonoma County Oral Health Program. What I'm doing there is I'm training all the school nurses on how to conduct oral health screenings using the basic screening survey from the American State and Territorial Dental Directors, ASTDD. And I'm making sure that, everybody is very comfortable with the different classifications of the screenings and helping them to enter it appropriately into the electronic referral system called APR 360, which we're hoping will help, with better timeliness of getting the children into appointments at the Santa Rosa Federally Qualified Health Center.
Hi, I'm Evangeline Ida and I go by Eva. So I'm a foreign trained dentist, as mentioned before, and one of my interests in dental public health is working in rural areas and improving oral health in rural communities, and also working with vulnerable population. So I learned a lot during my residency, particularly in dental public health residency. So first thing, I'm working in Butte County, and my ongoing work is I'm helping the county with oral health needs assessment. So this needs assessment, the purpose of this needs assessment is to know the dental health status in the county. So I learned how to do needs assessment in the residency. Like I'm still learning, but it's a very good exposure for me to implement that and also follow all the different steps. Like follow all the different steps in implementing this needs assessment and guiding and helping the county to do that needs assessment. So the other thing that I'm working in my county is it's a QI project, the quality improvement project, that is improving patient provider communication by implementing oral health literacy toolkit. So during our residency, we need to do a QI project that is at our field site, and my field site is Butte County. So I'm working with a rural health center, which is also known as Advanced Health Dental Clinic in Paradise. It's in Chico. So I'm doing that project as part of my QI project. And the other thing I'm working is I'm going in person to participate in school-based oral health events. As a foreign trained dentist, it's a very good exposure for me to understand how things work in the US, like during how we can improve in a school setting or something like that. So we usually do. I'm able to see sealants, like how RDAs or dentists work with sealants, screenings, and fluoride varnish. And I also have exposure by educating kids about different techniques like brushing techniques or engaging with kids and improving oral health during my field sites. And one major thing that I got an opportunity to work with my field site is because Butte County, it's a rural area. It's a suburban county, but still there are a lot of rural areas. And but there are a lot of great things that are happening by improving oral health in that county. So we are doing a workshop. We are presenting a workshop in 2024 national as well as state school-based health science conference. That's one of the good things. So we're able to share our strategies. So these are a few pictures from my field site during my school site visits. And this is a very recent field site trip to Chico. This is in Oroville, where I'm able to present, educate kids by showing different models, and the kids are engaged to learn different kinds of oral health. Like this is really nice. So that's one of the things I do in my field sites.
Hello, I'm Harpreet, and my field site, one of the field site is at Federally Qualified Healthcare Center, La Clinica at Fruitvale. And I'm part of this COSHI project, which is funded by HRSA. It is basically integration of oral health care and primary care at a state level and a local level as well. So I support them with some services which consist of integrating the prenatal and the dental team on one project. And one of the project that I'm working on with them is it's my QI project as well, quality improvement project. So we are doing same-day referrals for pregnant women who will be referred from the prenatal department to the dental department, just to increase the acceptance rate of women in the dental clinics at Monument, La Clinica Monument. And this is one of the patient education material that we worked on during my internship with them, volunteering with them. So it is an improvement of what they used to tell patients or do. They used to use this as a information for the telemedicine visits. And I am also working on one of the other projects with them on the information system as well. And the second field site for me is Santa Clara County Dental Society. Here I'm volunteering and I'm consulting them on their Give Kids a Smile program. This program is basically scheduled for January end, and we'll be volunteering dentists and talking to the schools and coordinating between them, scheduling their proper dates, doing all the program planning for this event. Currently, we are on a stage of volunteering. We are on a stage consulting for dental volunteers for this community event. Thank you.
All right, thank you, residents. And then with that, we'll move on to Dr. Hayam Magali.
Thank you, Dr. Annie. It's great to know about all the projects and the great work that the residents are participating in and the impact they have. So as you see here, I'm a dentist from Egypt. I practiced there for 5 or 6 years as a pediatric dentist. And when I moved here, I got my MPH, and I worked several years with the Central Valley Health Policy Institute. I participated in oral health needs assessment with the Fresno County, their health improvement plan and their evaluation plan. And after finishing my residency at DPH, I was qualified to apply for the American Board Certified Dental Public Health exam. And thank God I passed the exam, and now I'm American Board Certified Public Health Specialist. And this also provided me the experience, and just participating in the exam was huge experience for me, that I'm qualified to be a program specialist with Alameda County Public Health Department, and leading a project that it is a state-funded project to improve access of pregnant women to dental care within the county. So all of this experience that I gained from residency, from the being certified dental public health specialist, all of this allowed me to lead this great project. I'll give you some examples of how I participated in the residency. I will just give you if you think about this residency, I thought about it as not just as a student or a resident, as a job. So whenever I participated in any project, or being the field site, or with the research project, I participated as this is a job that I'm committed to do, and I would do my best and learn from all the mentors and the professors and the faculty and staff. So this was a great opportunity for me. And here the research day, this is the poster that I worked with my mentor, Dr. Jean Calvo, to create a poster. This is just an example of my participation in the residency and the project that I was involved in. Create a poster to share the idea of applying the teledentistry model in rural area to connect children at the school, and to do whatever preventive services that the RDHEP, or the registered dental hygienist in alternative practice, on site at the school, provide services and then refer to dental providers if there is an extra need. And this is the Smile Keepers photo. These are the great team that they have, the RDHEP leading their team, and they provide services in rural schools. So this is like my attending the field site with them and going to them to school, and seeing all of the great effort they do within their community was really very impactful. With the Tuolumne Public Health Department, this was my county site, and here it was a photo taken when I was by the program they participated, they collaborated with the tobacco prevention program to provide a CE unit for dental providers about vaping and tobacco use and how it affects the oral health. And this was a great collaboration between the office of between the oral health program and the tobacco prevention program. And I was very fortunate to participate in this presentation. This is also another example of my participation during the residency is with the VDH, or the virtual dental home workflow. This was a part of my quality improvement project. I attended with them. So I was like trying to create more effective workflow and increase the number of children they see each day. They go to that trip to this rural school. So we wanted to increase the number of students seen. So I modified a little bit, suggested some modification to the workflow that happened at the school, and also the communication between all the collaborators on this project. So this is the swim lane diagram that I created with collaboration with my mentor and my supervisors. And also this is another example with the medical dental integration presentation to medical providers at NFQHC in collaboration with Dr. Susan Fishin Owens, and with my co-resident Sharvari Karande. We participated in this presentation, and everyone was like amazed with the information and the depth of information that we shared. And the medical providers, they benefit a lot from dental trauma, managing dental trauma at the primary care setting. I think those are the things that just snippet of, the thing is, I tried to participate in every thing that I can and the time allowed. So these are some of the example of my participation. Thank you.
All right, thank you, Hayam. Okay, so with that, I think we can open it up for questions. For those of you who joined late, if you see that your name is Rachel Howard and you are not Rachel Howard, please click on the 3 dots at the top and rename yourself so we can know who you are and who is participating in this. Okay, right. So I guess everyone is available, myself, the residents, and Hayam. If you have any questions, please feel free to unmute yourself and ask your questions now. Now stop sharing so we can see your faces, and please, put on your camera if you can.
Hello, everyone. I have a question. If you don't mind, I can go ahead.
Please go ahead.
Sure. So my name is Prachi Kini. First of all, I'd like to thank for such an informative session. I'm a foreign trained dentist. I did my master's in public health from SUNY Downstate, Brooklyn, New York. And right now I'm doing my clinical preceptorship in Rutgers University. So my question is, I have been following the Instagram handle, and I have been through the webpage. I have been through the curriculum, and I know how intensive the program would be for a 1-year program. So I was wondering, how often would we get the projects, and what would be the time frame to complete the projects?
1 year. The program is 1 year, so the projects are completed within 1 year. So the requirements for the residency program are 1 major and 1 minor project. Typically, the minor project is gotten from your field site. So it has to be a community-based project. The QI course also requires that you do a QI improvement project, but that's not a full research project. It's really just a small test of change. So as part of your work at the FQHC or school-based program, we ask that you try to identify a pain point in that clinical environment and try to work on something that can improve it. So like you saw with Hayam, it was really just trying to improve the workflow. So observing the workflow and trying to improve the workflow. So that's not considered a full research project, but it is something that needs to be done. And we walk you through the process the entire year. So that course is held once a month. And so every month, the residents, it's a combined course with pediatric dentistry. So both the DPH residents and pediatric dental residents try to identify something that they can improve within their clinical environment and or public health, environment if it's a school-based program. and then, work on something to improve the quality of care that's being delivered. However, the two main deliverables are the major and minor project, and those are research projects.
All right, got it. Thank you.
Yeah, so it's
I
a
have
tall order, for 1 year, but it is doable if you roll up your sleeves and get to work from the beginning.
Correct. I have one last question. I saw on the website as well. I would of course like to get both certified. With the program, help me with that. And also, are there any opportunities to do a PhD after the program in dental public health?
The program is a certificate program, and it's designed to prepare you for the board exams. As a requirement, you have to complete the qualifying portion of the board exams prior to graduation. That is typically held at the end of March. So that sets you up to complete your board certification. Immediately you complete the residency program, because once you pass the qualifying exams and you graduate with your 2 projects in hand, pretty much you can just submit your 2 projects for the certifying exam, and you should be ready to take the board exam. And so we set you up for success, during the residency program. However, it's up to you and each individual resident to really take advantage of the opportunities that are available to pass, the board exams, and to put together a project that is ready for submission once you're done with your residency program. In terms of the PhD, we do not have any PhD programs. However, you can apply for a PhD in global health at the UCSF Graduate Division, or, any other PhD program that you're interested in.
All right. Thank you, Dr. Obin.
Sure. Questions, please don't be shy.
Hi, can you guys hear me?
Yes, we can.
Okay, my name is Barbara. I'm a 4th year dental student at Western University. I just have 2 questions. If we could have maybe like a quick run through of what a week of the life of a resident is like how often are you at the field site, how often you're on campus, and so forth. And then, Doctor, I know you had talked about the possibility of potentially doing, sorry, I'm in clinic, this is what you guys are hearing behind me, but the possibility of potentially doing field experiences at other sites. Could you talk more about what that process is and whether a student would be in charge of securing a different site on their own? Thank you.
Yes, I can run through what a week is like, but I would invite the residents to also tell you. I think it varies, but what is expected is that you spend at least 1 day a week, at your field sites. That includes both the public health department and the FQHC. And then you're expected to spend about, typically our didactic courses are grouped into Wednesdays and Thursdays. And so most times, all the courses happen on either Wednesday mornings, Wednesday afternoons, or Thursday afternoons. However, there are a few courses like the QI course that happens once a month on Monday evenings. And then I think there's DPH 475 that happens once a month as well, beginning in the fall on Tuesday mornings. So there are a few exceptions, but, most of our didactic courses are held on Wednesdays and Thursdays. And so we expect that the rest of your time, which would be Mondays and Tuesdays, would be spent, working on your research projects. So both your major and your minor projects. And does anybody want to describe what their typical day looks like? Lauren, Eva?
I mean, I would also say that we're here on Tuesdays as well. We're here Tuesdays, Wednesdays, and Thursdays. But I usually spend my field site is Friday. And then Monday is I work on my research. And there's prep work for all your classes. So there's that. I do a lot of that on Mondays or on the weekends. So.
And also in terms of field sites, it actually depends upon how you schedule your meetings in regards to your field sites. Because, for example, like my field sites, it's like it's far from San Francisco. So I go like for once in a month or for every 2 weeks, like depending upon the events that happen in that county, like school screenings or whatever, or I'll just have a meeting like every week with my supervisor in county, and then we discuss about different plans, and mostly we work virtually. But it kind of depends upon where you are assigned, like your field site. Is it like close to San Francisco or away, or it actually depends on the scheduled meetings and everything.
Yeah, so typically we encourage you to meet with your field site supervisors at least every other week. You know, if you can meet with them every week, that's fine. We also encourage in-person attendance as opposed to remote attendance. And so that may not always be possible every week. So you can decide if your site is far, like Butte County is, and you need 1 day to travel there and 1 day to travel back. You can decide to group it and go once a month, or, you know, once every other week, depending on how far your field site is, so that you can have like several days instead of just, you know, 1 day every week. So, you know, that would vary depending on where your field site is. And in terms of the location, so we do have agreements with a couple of field sites. However, you are not limited to those field sites. It just makes things easier so that you don't have to start from scratch. But if you have a field site that you want to work with, we're willing to set up a letter of understanding with that field site. It takes about 6 months to 1 year to set up a new field site to get an official training affiliation agreement. And so that is not always possible if it's a new site. However, we do accept a letter of understanding with the supervisor at the field site that you identify. If they're willing to work with you and they have something, maybe a project that you want to work on, then, you know, we can work together to get that letter signed. And that will be sufficient for us. It's not always sufficient for most field sites. So I'll just put that caveat in there. There are some field sites that require a training affiliation agreement. And so if they do not accept the letter of understanding, then you're back to one of the ones we already have. But if they're willing to accept the letter, it's non-binding and it's not a legal document. So that's why some of them do not accept that. We're willing to start the process if you let us know in advance. But like I said, it takes about 6 months. So that usually is not always possible if you've already started your residency program. At best, we can set them up for the next set, unless you're like in a 2-year program, like the first year in Berkeley, and then you're trying to cross over in the second year, then there's time to set that up. Okay. And with that being said, you know, it has to be a site that you can be physically present at. So if you're located physically in San Francisco, it's a little difficult for you to travel all the way to Los Angeles, you know. So we try to work within Northern California. All right, any other questions? Again, I still see one, Rachel Howard, who is not Rachel. So if you can rename yourself so that we know who you are, that will be great. Any questions? Well, there was a poll that Rachel put up, right? Do you want to talk about what the poll is? And then if there's any other information you want to collect from the participants before we wrap up.
In case anyone was having challenges changing their name, I did just send out a poll question for your name and email address. Otherwise, I do have your all's information from registration, but just want to also say thank you so much for attending. We really appreciate your all's time.
All right, we typically ask, you know, who is interested in applying for this cycle. So if you want to maybe indicate by raising your hand or, you know, like something. Okay, so I can see 2 people. That's great. All right. Okay, excellent. So again, okay, Miriam, I saw your hand go up. Olufemi, I see your hand. So that's about 4 people. Great. Okay, well, I mean, feel free to reach out, if you have any follow-up questions. The recording will be sent out at the end of this session. And we look forward to receiving your applications. With that, I'd like to say thank you. Thank you to our residents. Thank you to Hayam. Thank you to everyone who attended, took time out of your day to attend. I see Dr. Pollock. Hi, Howard, who was our previous program director. And so, yeah, it's nice to have you here. Howard, do you want to say a few things? No? Okay, all right, well, with that, I'll say thank you and bye.
Thank you
Goodbye.
very much.
Okay, contact information. Oh, that's our contact information. All right, bye.
Thank you.